Look at our fun mugs.
Are they so cute?
They are so cute. I love these mugs. So, you know, we love Botox, as we know,
do.
right? And Nurse Liz here, I want to hear about, like, your favorite new treatment. Not new, I should say, but it's more new for the average Joe. So what are we talking about today?
Well, I want to talk about Morpheus8 because it's a game changer for everybody.
Oh, my goodness, is it ever?
Yes.
Because it changes not only in your skin, but it changes just the texture and the look and the, I mean,
breaks down that bad, you know, like stretch mark, the scar tissue, the acne scarring, the pore sizes, makes them smaller. It takes away that, you know, the scarring and rebuilds it with collagen and good tissue. It's amazing. And it only takes 3 treatments to get going with that. I know. And you're building collagen for a year.
Yes.
Who doesn't want to build collagen? We stopped doing that at the age 24.
Well, people take collagen and they think, which is internal.
Yes.
But you also need to build new collagen.
Well, if you're not doing something to tell your body to restart producing, it's not going to.
Right.
So Morpheus8 is the kickstart for that. It's like, it's talking to the body saying, hey, come on, we need to get in there and repair and get this fixed. So that's how, and people do notice after the first treatment, but after the second, they notice a lot more. And then after the third, they're building for a whole year. They're building collagen. So it keeps going.
I'm sure our audience is like, what? No, what is this? They're probably at the edge of their seat to understand even more what this is. So Morpheus8, no, it's not part of the movie Matrix. It's not it's not Morpheus in that regard. Even though I love that movie. It is a radio frequency and heat device that is developed by InMode.
Right.
And
with needles.
With needles. So what this is radio frequency microneedling. It's at a whole nother level. Because a lot of people have had microneedling before.
Right, and it works too, but this works better.
This is like on steroids. I mean, come on. It's on a whole nother level.
Right. You actually can tighten your skin with this.
Yes.
It actually will, because it's building collagen, it's actually tightening the skin.
Yeah.
And you come out looking like your pores are a lot smaller and just a real refined look. Like if you have, as we age and our skin ages, we have larger pores. That's just what happens. So this device will help reduce the pore size, makes it look more softer.
Sure. So take us back to like what a client would experience. So let's say they got scarring or they have stretch marks or they just need their skin repaired on their neck or their face. They have sun damage, they have big pores. So they come and make an appointment. So what's the best way how do they get an appointment? How do they engage with us?
Well, they just need to they can schedule a consult, a Morpheus8 consult appointment, because not everybody is eligible to have this done.
Okay, so everyone should have a consult.
They need to have a consult. Okay. It's important. So
so remember that, listeners. Schedule a Morpheus8 consult first.
Yep, they schedule that with the nurse. Then they come in and the nurse will go over some things with them, make sure they are a right candidate for this.
Yep, okay.
And then we will schedule out your 3 appointments because they need to be like 6 weeks apart. We're not going in every year, because you're not going to have the results. These
so you got to stack them.
You have to stack them.
So once
3 treatments.
3 treatments once every 6 weeks.
Yes.
6 or 7
you can go 7 weeks if you need to, but basically, you want to schedule it for every 6 weeks, and you want to stay on top of those treatments, and you're going to have the best results. Okay, so you guys, in your consultation, you'll check if they're a candidate. Yep. You'll come up with a treatment plan, costs, everything. They can buy a package of the 3. Yes.
Now, there is numbing cream involved because, first of all, it's a little invasive. You're going deep. Now, it's called Morpheus8 because it's 8 millimeters, but you're really not going to 8 millimeters. No, correct? You're going to 7. You can go to up to 7. Up to 7 millimeters deep in the derm. Is it the dermis? Am I saying that correctly? Right. Well, you're going past the dermis. In the levels. Depends on what level you're at. But you can go up to 7 millimeters deep. Okay. So you do need a numbing. You need to numb for an hour. Because otherwise we need to prescribe that. So we need to order that prescription. That's part of being the consult, because then we can order your prescription. Yep. And the treatment takes maybe 45 minutes to an hour, depending on what you're having done. Okay. And we will be as aggressive with it as you can tolerate. Yes. So if you tolerate it, I'm going to give you an aggressive treatment because you're going to love it. Yes. People seriously Google Morpheus8. You really need to look at the before and afters. It's unbelievable. So let's go into some depth about Morpheus8 as far as what it can do with Because when you say aggressive, because I've seen I've seen a lot of the work you've done, and you've done it on me even.
Yeah.
I know, like, the back of, like, when people, like, when you stand in your bikini and you look, like, your butt and the back of your thighs, first of all, it takes care of a lot of the cellulite and the lumpy bumpiness. It smooths it out. So you went aggressive, but you were saying you did bursts with me, and you double stacked or whatever.
Right.
Where it was like killing fat and tightening skin.
Right. So on the body, let's talk about the body, because we don't want to destroy fat on the face. We want to make sure that we don't do that on the face. But on the body, of course, we want to destroy fat, because nobody wants that fat, right?
Yep.
And so when we are going in with the needles, we can set the device to actually burst energy, like at different levels, or we can have it set to burst energy at the same level.
Gotcha.
So when I would go with, let's just say I use 7 millimeters deep on you.
Yeah.
We couldn't with you because you don't have that much fat on you. But,
certain areas I do.
Yeah, but if you use a 7, it would I could hit 3 levels with one,
like, injection
one actual shot.
Gotcha.
So like you would go 7, 5, 3.
Gotcha.
Because it would go in deepest, then come out, and then do 2, and then come out 2 more.
And this goes super fast, people. Yeah. Like, it's not like we're standing there. It's like, it's super fast. It goes do. And then you just go in each section.
So then you would you could do 7, 5, 3, and then the next set I would do 6, 4, 2.
Oh,
so I would hit you at every single level.
And you're bursting in radio frequency and heat in those areas.
Yes.
So you're kind of injuring, if I'm saying the word right, a little bit.
You are melting fat.
Yes.
You're destroying the fat cells so that your body, your lymphatic system, can wash all the fat cells, all the fat out of there.
But you're doing tiny, like, injuries to help with collagen, elastin, all of that.
That's the needle work that's happening.
Gotcha.
So with the body, we use 40-pin needle.
Okay, so it's like a little gun, and you can look this up on our website, and you can see all the stuff. But or just Google Morpheus8 if you want to. But it's on BotoxBar.com. But it's like a little gun, and it's got 40 needles at the tip, and so we just put it on and go.
The heat just goes through the tip. The energy goes through the tip of the needle.
Yeah.
So it's not damaging your skin.
And like you said, you're numbing for an hour. So you come in an hour before your appointment, you get numbed up, and then you get your appointment.
Yes.
Your treatment done, I should say.
Yeah. And I'm going to be honest with people. Some people think that it's not comfortable.
Yeah.
Other people don't have any trouble with it. So it just depends on where you are with your pain level.
Well, and it depends on what's going on with your life.
And what's going on in your life.
Because I've had my neck and my face done, and with resurfacing and the whole thing, and with Morpheus, because you can resurface with Morpheus8, which we'll get to in a minute. But my point is, my face and neck, I didn't feel a darn thing. You were going for it.
Right.
We did the back of my legs. I was jumping off the table a little bit.
You can use a higher energy. First off, let's back up a minute.
Yeah.
Anytime you're destroying fat or tissue or anything, you're gonna have a little bit of discomfort because
But once the needle was gone, it was fine. It was just like that 1 second. Like,
exactly.
Yeah, it's not
because
like you're
putting in
going home in pain.
Right. So we can put quite a bit of energy in there to destroy that.
Yep.
And so that is what is not comfortable.
Yes.
It's not actually the needles. The needles.
The needles don't really hurt.
It's pretty much, the numbing cream takes care of the needles.
Yes.
It's the energy that's going in there that's doing the work, per se. And so, it does cause a little bit of that.
How would it, and maybe you don't know this, but how would it compare to, like, people, like, when they get tattoos? Because tattoo can hurt. I don't
think, tattoos, I've never had one, so I can't really speak to it. I just know, talking with people that have had them, it's more surface work. This is deep.
It's pretty deep. Yeah, that's why we really numb you up good.
Yeah.
And you can put the CO2 mask over the numbing cream.
Yes, and it will just help your numbing cream to go deeper, and it'll help your healing process afterwards
even faster, which is so cool that it can make that.
Because it brings oxygen to that area to really heal and recover.
So what we're saying is there's a CO2 mask that we have. It's like a gel. Yeah. And we can put it over the numbing cream, let it sit for the 45 minutes or to an hour.
Yeah.
Then we take all of that off in sections as you're treating them.
Yeah.
But then you can also then take a mask home
yes.
and put it on there, you know, the next day, 2 days, whatever.
Exactly.
And that way that will push the healing process to move faster.
Yes, it will, because it brings the oxygen to that area in large quantities. So you're really healing.
Yes, yes.
Really
so people that really
a healing environment.
Like if this is your year, whatever year you're listening to this podcast or watching it, it's like this is really the game changer. Like you lose weight, or you're finally where you're kind of wanting to be, but there's problem areas. Like mine, always like I'm full Italian basically. So I got the underarms, you know, the Italian arms. I want those done. I want the mom knees.
Yes.
So you guys know what I'm talking about? Those mom knees, or get the little wrinkles, and then the elbows, around the elbows, right? You do that.
Yeah.
Face and neck for sure. What other areas have you done that were like, okay? Oh, the stomach.
The stomach and the butt. The bottom of the butt, top of the thigh, up by the hip area or waist.
Yes.
Yeah. Back fat.
That back fat, yeah.
You can do just about...
I know, but we can't do too many areas at once, because you can't have too much.
And the reason, because of lidocaine toxicity, you have to. You can only treat a certain area.
Yeah.
And then you have to do. But it's got to be
And we have it where we charge by area, if you will. So neck and face are one area.
And when you do your neck and face, we throw in resurfacing.
Yeah,
and do that.
That's a huge saving. That's almost $2,000 to do resurfacing, and you get that free with your neck and face, because we're like, you know what, you're numb, you're there.
We want you to have the best experience, and we want you to have the best outcome.
Yes.
So the actual resurfacing helps a lot with that process.
And I think too, and we'll talk about this on another podcast, but you know, you're investing in yourself and getting really like cleaning up your skin.
Yes.
You want to protect that investment with really good skincare.
Absolutely.
I mean, you can't be
we're talking about,
over the counter.
We're going to do a podcast on good skincare.
Yes, so you'll want to listen to the podcast on skincare. And we have one already that we're interviewing someone from Is Clinical.
Right.
But we'll go into all the different skincares. But you really need to have good skincare after you do something like this. You're spending time and money and effort.
I'm always saying there's not just one way to take care of your face. You have muscles, which Botox takes care of. You have volume loss, which fillers take care of. And you have skincare and treatments for your skin.
Yeah.
Which is, your canvas.
Yes, you want it to. And so many people will come up to me, and you. I said, it happens to us all the time. Your skin looks amazing. It glows. You have no pores. Like, what is going on with you girls? Like, why is your skin flawless? And it's like, well, first of all, it's like, we have a less amount of wrinkles because we're doing Botox and fillers, but now we're also doing Morpheus8. We're using really great skincare. We're using, we're throw this kitchen sink at it. We do it all, but we don't do plastic surgery. No, that's not happening.
No, but we've talked about this. We are not going to go down without a fight. We're going to use what we have at our fingertips.
Absolutely.
And so, like I said, if you can't afford to do it all, let's get a plan together where you can at least start. Because if you're doing nothing, anything's going to be helpful.
Oh my goodness. And we see the transformation our clients go through.
Yeah.
It's so
putting them on the skincare, oh my gosh, it's so great to see them come back and their skin is just changing.
And you can tell the ones that have done Morpheus8 at our clinic.
Yeah, you can.
They look fantastic.
They do.
They literally look amazing, and we want to make sure that that they keep that going on, because
let's get to that. So what it is you have 3 treatments.
Yes.
And then you go for the year, and
once a year.
Yep. Then you come back every year for one treatment.
Or
you can do 3 more if you want. It's not going to harm you in any way. It's just going to keep helping you.
Yes. And some people might need a 4th treatment if they really have a problem area. Or let's talk about acne. Because acne is a big one. You need 4 treatments.
You need 4 treatments. And if you think about that, with acne, you can, when you put that energy and heat into the skin, into the acne, it actually will kill the bacteria that's down there.
Yes.
Because that's what's causing the acne. It's the bacteria that's buried, and then it comes up and surfaces and causes the zits.
If you're under 18, we really don't want to treat you yet, because you're going through hormonal stuff, whatever.
You are,
Once you're an adult and you have it, and you're still dealing with acne, or you have acne scarring, now you want to come to us. But we still got to look at your Fitzpatrick's level of your skin tone to figure out. And I know our audience probably is like, what's Fitzpatrick? It's just basically what skin tone are you, because there's certain skin tones we can't do because it will darken your skin or lighten it, and then you'll have off skin tone. That
is part of the consult, because the one thing I have seen is clients coming in who have been to other places and had treatments done that they weren't supposed to have because of their Fitzpatrick score. And they have dark spots all over their face, and it's not pretty.
Nope.
It's terrible for them.
We're uber careful, and we make sure we're doing the right treatment with the right people, and we're very upfront if we can treat you or not. That's why you need that consult. Plus, there's a lot of other medical things that we got to ask about. We got to get your prescription. We got to come up with a plan. We got to set it all up. We got to.
And you always need a plan. I mean,
you do.
You got to have a plan so you know where you're going. And that's there. That brings up another subject. How do we move forward? So if you need fillers and you want to do Morpheus8, we need to know the order of all of this stuff, right? So if you're going to do fillers, you want to do your Morpheus8 first. You want to do your Morpheus8 first, and then you put your fillers in.
Yep.
Yeah, you're not going to go the other way around, because some fillers you can't do Morpheus8 until
it's going to break it down.
Until half of their life.
Oh yeah, that's right.
So if the filler it lasts a year, you can't have Morpheus8 for 6 months.
Right.
So you always want to start with Morpheus8. Plus, Morpheus8 is correcting. It's going in there and correcting everything. So then when it's done, you can see what you actually need.
It's like the magic eraser.
Yeah.
Especially that resurfacing. Oh my goodness.
Exactly.
Let's talk about some medical treatment or medical reasons that we've seen. For example, we've had clients that have had tummy tucks and they have all the scarring. And we can break that up and help with that. Like if you've had procedures and you got scars from that, knee surgery. If you have a big knee surgery scar,
with knees, I don't think you can. If you've had a replacement, you wouldn't be a candidate for Morpheus8.
Okay, that's all I'm asking.
Right, you would not be a candidate. So, because of the fact that you have a rod in there
and metal,
it would burn inside. So we wouldn't be able to do we wouldn't be able to do any of those types.
Or hip replacement.
But if you had like a scope or something where they had to go in and they gave you some scarring on your knees or whatever, or any type of scarring. Like I've done some tummy tucks, and where they've come in and their scar is real thick, it's red, and it just doesn't look nice.
It's raised.
And so I've been able to go in with the Morpheus8, break that up a bit, and change the color and the texture of the scar a little bit.
Smooth it out. Are there any scars you can't touch with this? Or pretty much is it
just the ones that are over like metal or something of that nature.
Okay. And then there's small areas that you do. So you can just get eye treatments. So you know how like sometimes the crow's feet is just relentless. You're doing Botox, but they're just a little too deep, or Botox is not enough.
Well, or you've waited too long.
Or you waited too long.
Too long to start your treatments, and now you've really damaged the skin through movement and everything. You can come in and repair some of that with the Morpheus8.
Yeah, so you can just do the small, but it's like you can, if you just want to get your eyes done, fine.
Yeah, exactly.
But it's like for a little bit more, you get the whole face and neck done, and you get the free resurfacing.
Exactly.
So, whatever your budget is, but you still need the consult.
So you still need the consult. Absolutely. And we can do the eyelids, too.
Yeah, that's right. You can do the eyelids.
Yes.
Oh, that really helps. So does it help lift the eye? Does it help?
It just helps. You know how you get that crepey look on your
like
eyelid?
when you put eyeshadow on, and it's like,
it just tightens that up and it changes that texture of your skin.
Oh my goodness, that's huge. Yeah. And there's men that are getting it done more, so because it's not Botox and filler. So those who maybe are more adverse to, I want to be natural and I want to be, I'm like, okay, that's, and that's our whole idea of this is to prevent surgery, right?
Yeah, absolutely. To just
You want to look natural.
Look as natural as you can.
Yes.
And to enhance your natural beauty and not change it.
Yes. And but if you're adverse to, like, you don't want to put Botox in your face or filler, fine. Morpheus8 is a great way.
It is.
To really do some things.
Yeah.
And lift your face and magic erase the age away. I love that.
I know.
And then they don't have there are no chemicals involved. The only chemical is the numbing cream. But that's just for
but you
that
have to have the numbing cream.
You
will not be able to take the...
No. You'll be jumping off the chair. Yeah.
And, I should just say that we do have some doctors that do this treatment here.
Yeah.
And, they see what it does and they want it too.
Yep. Yep, exactly.
I love that.
I do too.
Yep.
It's so impressive. I mean, this technology, it's so well put together. It's clinically trialed. It's got really good results. You're not going to get injured, if you will, because it's all encapsulated needles, so you're not searing through the skin. It's only at the tip of the needle is where that energy burst and heat comes out of.
Right.
So for those of you who are concerned have done radiofrequency microneedling, you may have had a bad experience back in the day, but it's not like that with InMode at all. No. That's why we partner with them.
But that's, you need a good practitioner too, because you can... if you're not allowing the needle to complete before you remove the needle, you could damage skin. So you just have to be you have to have a good practitioner.
Certified practitioner. Yes. 100%. And all of our nurses are, so we're good.
Right.
And you've had, I think too, when people come back, I've seen, like, I remember a client of ours, we were just doing her under her back of her arms or whatever.
Yeah.
Unbelievable. Like, it didn't even look like the same arm in the before and after. No. Like, it just different. It's more chiseled. It's tighter. It looked, it's unbelievable.
The skin looks way different.
Yes.
Like, I have people that, like, I have a client that comes in and gets the back fat done.
Yep.
And when she started coming, that back fat looked totally different than what it looks like now.
Wow.
The skin looks totally different.
Yeah. So it's a real gift to yourself to do something like this, because you're like, well, how long does it last? I'm like, well, it's permanent. I mean, it is. I mean, you're still aging and you're still, but it's a permanent thing. Otherwise,
it is a permanent thing, but you are aging. So let's just say this. If you come in and you get your 3 treatments of Morpheus8, and then you go home and you never come back, after a year, you're going to stop building collagen again.
So slowly start coming back.
Your body needs to have some reason to build, because it's lazy.
That's why you wanted to do a once-a-year maintenance.
Yes.
Once every 15 months. Something.
So when you stop building collagen, now you're going to start seeing the same problems you had before you started.
Yeah, you just keep it nice, keep it tight.
Yes, exactly.
You know what I mean?
And don't wait too long, because if you wait too long,
then you got to start over. You feel like you got to do 3 again.
Exactly.
Yep.
Yeah.
That help. If you want to help with the purse strings, just do the 3 and then come back a year later and then just do it once a year and then you're good to go.
Yep.
Yeah.
And I always say, if you want these things, you will have them. I don't care what I want. If I want it, I will get it.
Where there's a will, there's a way.
I will get it somehow. Yes. I will change something else so I can have it, right?
Exactly.
And that's the way women are. We're that way. And men are that way.
Yep.
We are just we're that way. And so I don't go to coffee shops. I don't go to tea houses.
Yeah.
I choose to use that money for other things.
Right.
So it's a choice. It's just a choice.
Yeah.
And so if you want it, you can have it, and you'll make it happen.
Absolutely. And I think too, as men and women are getting this done, they're feeling more confidence. They're feeling good about themselves. They're telling their friends and family. They're starting to see, like, wow.
Well, people are looking at them and going, "What have you changed?"
Yes, it's dramatic. It's very, but you got to get the 3 treatments minimum. You really do. You got to buy the pack of 3.
It's important. But I have had clients come in and do 1 at a time.
Yeah.
But they have to pay for it. It's more expensive that way, but they have done that.
Yes.
Because they can't afford to buy the package all at once.
That's true. And we have payment plans. We can do the payment plan. We have Cherry. We have Care Credit we can accept.
Right.
So we make it easy in that regard. But I think, investing in some skincare when you're all done, too, especially if you're doing the face and neck.
Yeah, absolutely.
Super smart idea to do that, because it's worth it and it lasts a long time.
It does.
And
we know, beauty is expensive. It just is. And there isn't anything anybody can do about that because it just is.
It is.
And we all want it. And so, I mean, we all want it. We want to look and feel our best, right?
Yeah, at every age. We say it all the time, right?
Right. Yeah. And it doesn't matter how old you are. And it's not that you're trying to impress anybody or anything like that. You're just trying to be your best self.
Yes.
Put your best foot forward and be your best self.
Stand taller. Okay, yeah, keep your head up, feeling good, because you attract more people to you when you're confident, you're feeling good, you're willing to more speak up for yourself, you're willing to do things you weren't were willing to do before if you were feeling kind of sluggish or feeling not yourself.
It's a confidence builder. If you are dressed nice and you know you look good, you're going to walk with a different walk.
Absolutely.
And if you go into a store, you're going to attract more attention.
Oh, yeah.
Like, if I'm going to go shopping, I don't go grubby because I want the help.
Yeah, you want good service.
I want the service. Take care of you. Yeah. I dress just like I normally dress. I always dress to make myself, to be my best self.
Absolutely.
Take pride.
I don't take pride. That's right. So Morpheus8, it's been around for a few years or more actually, and InMode's always doing updates and things with software and things. We're always got the latest and greatest here. We're one of the top 10% of. We're in the top 10% of retailers or providers of Morpheus8 in the country.
I know, it's amazing.
We're up there, so we know what we're doing here when it comes to Morpheus8, and you want to book that consultation, trust your provider, talk through everything, and book your appointments. You're going to be super excited. Now, one thing that we do, quick question is, a lot of microneedling, they say don't do in the summer, or when you're doing laser and that kind of stuff. Now, this is not a laser.
No, it's not.
This is radio frequency microneedling, but you can do this in the summer.
You can. But however, I should tell you, if you do choose to do it in the summer, it's a couple of days that you're not going to want
to be in the sun.
And the biggest part of that is it burns.
Yeah, because you have fresh.
Well, you already have heat and energy that was put in your skin.
Right.
So the sun will burn. Like, I had a pair of leggings on. I had done my legs.
Oh yeah.
Just by my knees.
I think I remember this.
And I went home couple days and I sat out on my patio and I had black leggings on, and all of a sudden my legs were on fire. And I'm like, oh my gosh, my legs are on fire. What's going on? Well, I had forgotten that I did Morpheus8. So I went inside and I grabbed a blanket and put them, and then it was no problem.
Yep.
But the sun, just that heat hitting.
Yes, I remember you telling me about that. You're like,
it was like on fire. Like, but my face, I didn't have that because I had sunscreen on.
Ah, but your knees, even though you had clothes on over it, the sun wasn't hitting directly. The heat causes things to really heat up, and you don't want to go into a sauna. You don't want to take a bath.
No.
After this, you got to give it some time to cool down, and we do bring.
You need 72 hours.
Yes, you need 72 hours
for all those holes to close and heal.
Very good point. So you really don't want to be putting makeup on right after. You need a good 3 days to...
It's Aquaphor. 72 hours. And that's the Aquaphor
we send you home with Aquaphor, by the way. So Aquaphor is it calms that down, but it seals it so you're not getting bacteria in there.
Right. And I mean, you can put mascara on if you want. We're not doing anything there. You can use mascara. So you can still put your
lip balm on, or if you want a little lip gloss.
But that's about it. Yeah.
So you want to schedule it. Maybe if you're not going to be around people for the weekend, schedule it on Thursday or Friday, and then
it's social downtime.
It's social downtime.
You can go and do things, but you're just not going to be able to put makeup on.
Yeah.
Like, you're not going to look funny per se. Like, after a few hours, the redness kind of goes away. And you're not going to look bad. You're just going to not be able to use makeup. So if you
for those ladies that wear makeup or guys that wear makeup, you're not wearing makeup.
No, you're not wearing makeup for 3 days. So
that was I wanted to make sure I brought that. That people wanted into that. They're like, oh, I thought I could put makeup on right away. It's like, not really.
Nope. You got to wait for those holes in your face that we've created to heal.
Yeah, but you can use that CO2 mask.
Yes, you can. That will help it.
Yeah, that CO2 mask will help move it along. That's $200. Right. It's a great thing. But it's a nice add-on when you're putting the numbing cream on, because it does help make the treatment a little bit more comfortable too.
Yes, it does.
I'm
Absolutely.
super grateful
I would
for
agree
that.
with that. Yep.
Yes. So well, come see us at the Beautox Bar for Morpheus8. Check it out on our website. You can look at our injectables, and then you'll see our treatments. Morpheus8 body tightening or face tightening. It should be under.
Yep.
And then I would Google it too, just so you can see what's out there.
Get the facts on it before you come in, so that you have some questions that you can ask the provider. And we're here to help you.
Yeah, we want you to look and feel your best at every age. At the Beautox Bar, where shots and beauty mingle.
Thanks, everybody.
Thank you for watching.